Abnormal psychology, it's a branch of psychology that deals with psychopathology and abnormal behavior, especially in a clinical context. The term abnormal psychology covers a broad range of disorders, from depression, obsessive compulsive disorder, personality disorders, anxiety, bipolar disorders, all those things. Counselors, clinical psychologists, and psychotherapists often work directly in this field, including psychiatrists. We should also occupy psychiatrist here. The term abnormal itself is a subject of considerable debate. Abnormal means what? What is normal? These things will be covered in my next slides. What exactly is normal and who gets to decide? Who is supposed to decide what is normal and what is abnormal? The social norms that are often used to determine what normal versus abnormal can also shift over time. So, settling on a standard definition, is it simple or straightforward? What is abnormal psychology? Abnormal psychology focuses on the pattern of emotion, thought, and behaviors that can be signs of a mental health condition, mental illness condition. Rather than the distinction between normal and abnormal, psychologists in the field focus on the level of distress that behavior, thoughts, or emotions might cause. The behavior, thoughts, and emotions sometimes do cause a lot of distress in people. And such conditions, whatever problems arises out of that kind of thought pattern, behavioral pattern, emotional patterns, those are called actually abnormal behaviors, and the psychology which is studying that abnormal behavior is called abnormal psychology. If a behavior is creating problems in a person's life or is disruptive to other people, then this would be an abnormal behavior. In such a case, the behavior may require some type of mental health intervention like psychotherapy, counseling, or psychiatric medicines, which may be useful for the person. How abnormality is defined? There are different ways of defining abnormality, but mainly the following characteristics are usually present. Abnormal behavior occurs infrequently. However, statistical infrequency alone is not a sufficient definition. Some healthy, desirable, and beneficial behaviors also occur infrequently, and other uncommon behaviors or characteristics have no bearing on how a person behaves or functions. So just because something is unusual or uncommon does not mean it would be defined as abnormal. For example, many people do have a lot of negative thinking. In general, up to an extent, negative thinking is a positive way of planning something ahead. So we should clearly understand negative thinking in normal circumstances, which helps the person to plan in advance, is not abnormal. At the same time, negative thinking which creates havoc in his life is abnormal. Abnormal behavior creates distress. These behaviors may disturb the individual or they may be upsetting and disruptive to others. How abnormality is defined? Abnormal behavior affects a person's ability to function. People who are displaying these behaviors may struggle to function normally in their daily life, which can affect their relationship, work, school, and home life. Just before I spoke about negative thinking, the negative thinking, which is in normal case, helps them to plan in advance, is normal. At the same time, the same negative thinking is totally ruining their life and it is affecting their relationship, work, school, and home life, etc. Like in OCD pattern, that is abnormal behavior. Abnormal behavior is socially disruptive. It may violate social norms and make it difficult for people to function in social settings and maintain social relationships. Perspectives on abnormal psychology. There are a number of different perspectives used in abnormal psychology. While some psychologists or psychiatrists may focus on single viewpoint, many mental health professionals use elements from multiple areas in order to better understand and treat psychological disorders. There are a lot of tools available with which we can easily find out what kind of mental disturbances these people are having. psychoanalytic approach. This perspective has its roots in the theories of Sigmund Freud. The psychoanalytic approach suggests that many abnormal behaviors stem from unconscious thought, desires, and memories. Unconscious thought that are actually innate in a person. While these feelings are outside of awareness, they are still believed to influence conscious actions. Therapists who take this approach, that is psychoanalytic approach, believe that by analyzing memories, behaviors, thoughts, and even dreams, people can uncover and deal with some of the feelings that have been leading to maladaptive behavior and distress. This approach was the first in the field of psychology. Sigmund Freud is the person who coined the psychoanalytic approach. Second is behavioral approach. This approach to abnormal psychology focuses on observable behaviors, the behavior a person has, behavior he shows, and the behavior which are abnormal. In behavioral therapy, the focus is on reinforcing positive behavior and not reinforcing maladaptive behaviors. These positive behaviors, maladaptive behavior, reinforcement, observable behavior, behavioral therapy, all these things will be covered in future lectures. The behavioral approach targets only the behavior itself, not the underlying causes. When dealing with abnormal behavior, a behavior therapist might utilize strategies such as classical conditioning and operandi conditioning to help eliminate unwanted behaviors and teach new behaviors. Classical conditioning and operant conditioning, broad topics, they will be covered in next lectures. Medical approach. This approach to abnormal psychology focuses on the biological cause of mental illness, emphasizing understanding the underlying cause of disorders, which might include genetic inheritance, related physical illnesses, infections, and chemical imbalances. Here, chemical imbalances are usually caused in the neuron structures. Related physical illnesses, infections, chemical imbalances, medical treatments are often pharmacological in nature, although medication is often used in conjunction with some type of psychotherapy. Cognitive approach. In the cognitive approach, abnormal psychology focuses on how internal thoughts, perceptions, and reasoning contributes. Whereas in behavioral approach, the behavior was also taken into consideration. Here the behavior is not taken into consideration. Cognitive treatments typically focus on helping the individual change their thoughts or reactions. Cognitive therapy might also be used in conjunction with behavioral methods in a technique known as cognitive behavioral therapy. Topics in abnormal psychology. The main topics in abnormal psychology are the study, understanding, diagnosis, treatment, and prevention of psychological disorders. Psychological disorders are defined as patterns of behavior and psychological symptoms that impact multiple areas of life. These conditions create distress for the person experiencing the symptoms. Topics in abnormal psychology. Second, anxiety disorders such as social anxiety disorders, panic disorders, and generalized anxiety disorder. Mood disorders such as depression and bipolar disorder. Neurodevelopmental disorders such as intellectual disability or autism spectrum disorder. Neurocognitive disorders including delirium. Personality disorders such as borderline personality disorder, avoidant personality disorder, and obsessive compulsive disorders. Then substance use disorders. All these disorders will be covered in future lectures. Criticisms of abnormal psychology. There are, of course, criticism for abnormal psychology also. The field of abnormal psychology is not without criticism. In addition to debates over the use of term abnormal itself, the belief that this area has a number of shortcomings. People don't agree what is abnormal. Why? Because abnormal is something which is far away, created far away from the normal population, and those people will be termed as mentally sick people, which are not good for the humanity. In particular, some feel that this area stigmatizes vulnerable and oppressed people. Critics also suggest that the field of abnormal psychology tends to pathologize normal variations in human behavior. Some also propose that the medical approach to mental illness often focuses only on biological and genetical determinants of distress rather than taking a more holistic view. It also does not account for the fact that there are major cultural differences in what is deemed normal or abnormal. Cultural differences we should take care of. Chinese will be behaving in a different patterns, Indians will be behaving in different pattern, Western countries will be behaving in different patterns, and that doesn't mean each of their behavior are abnormal or normal. This is the main criticism of abnormal psychology. Thank you very much for watching this video. Please be with me. I am going to provide a lot of information about psychology in future lectures. Thank you.